Hamilton Mayor Fred Eisenberger joins us this morning with the latest on vaccine efforts in the city. Good morning.
Good morning. Hope you're having a safe Easter weekend, everyone.
Yes, safe and social distanced. Yes, we're all good here. Want to talk about our top story today. Sylvie Lenvay's been reporting on the clinic near the Hamilton General Hospital that just, it had spaces this weekend for people 70 and older, and there were spots that went empty. Is that frustrating for you?
Sure it is. And, it's a function of, folks that might have signed up at that location and didn't attend for their vaccination. And, the vaccinations are very tightly controlled. And the next age group, actually, which is 60 plus or 65 plus, is very large. And so to be able to backfill that with the folks of that age is going to be challenging until such time as we have a more secure certainty of vaccine supply.
Mm-hmm. And I want to touch as well on the fact that a number of pharmacies in Hamilton now have the ability to give out the AstraZeneca shot, but yet there's an odd distribution of where those pharmacies are, and it's the province that decided that, correct?
Exactly, in concert with the Pharmaceutical Association, and unfortunately, they left a bit of a void in our lower city. So we're going to be taking that up with the province. Not sure why they've decided in that way. We certainly got about 21 or 22 locations identified throughout the city, but not in the lower city. And so we're definitely, the demand and the need is probably highest and greatest there. That's where the highest density population tends to be. And so there's a real need to ensure that pharmacies in those locations are able to administer the vaccine as well. So we're going to take that up with the province and hopefully get them to adjust that to ensure that better distribution is available.
Mm-hmm. Do you feel Hamilton's getting its fair share of vaccines?
Well, we've argued that because Hamilton has higher cases than some other locations, that we should get more vaccine as a result of that. So that's one issue that we certainly identified. We have vaccinated 100,000 plus individuals in our community, so we're not doing badly relative to supply. But, we could always use more vaccine. And so, the Rosedale Arena has not been open largely because there's been a slowdown in the vaccine delivery, and we're trying to manage our resources as best we can. So we're going to be operating the facilities that we already have up and running and maximize the output there before we get into the next wave, which is really going to be the mass of the population. When we start looking at 65 and under, that's where the most of the population actually resides, and that's where the biggest number of needs are going to be in terms of vaccination. So that's going to be a particular challenge, and we'll open up other facilities as that demand starts to increase.
Mm-hmm. Can you see Hamilton switching towards, not people coming to the vaccines, but maybe the vaccines coming to people? And I'm thinking of large areas, university, colleges, eventually, and even like factories, plants, where there are workers who are still coming into work every day and don't have the vaccines.
Yeah, and unfortunately, the Pfizer, Moderna, AstraZeneca vaccines have very specific transport requirements, and so that makes it very difficult to move them around. The Johnson & Johnson vaccine, the single dose, doesn't have those, large deep freeze refrigeration requirements, and that may make it possible for the vaccine to travel to individual homes, that folks that are locked into their homes, and potentially, maybe, to locations that need vaccine sooner rather than later. So I think it's the transport of the vaccine that's the challenge. Right now, we need people to come to the vaccine by and large. But if Johnson & Johnson is more available, that certainly could change the approach.
Right. How are we doing with restrictions?
Well, the case numbers are still high in Hamilton, and we keep advocating for a balanced approach, trying to keep schools open to the best degree possible. I think that's that's good for the kids, it's good for mental health issues. Having said that, there is an increasing demand for vaccinations for teachers, and I certainly support getting our essential frontline workers, like teachers, like grocery store clerks, and others that are constantly in contact with the public, to get them vaccinated sooner rather than later. More restrictions may be required if these variants start to spike even more. And so I'm going to leave it in the hands of public health and the province, who are basically making those decisions on our behalf, and we're actually required to enforce them. So
Right.
I'll wait to see what the public health officials decide over the next coming days.
Okay, Mayor Fred Eisenberger, thanks for joining us. Stay safe.
You too. Thank you.